Just connecting something quickly. Just connecting something quickly. So Matenga, I see YouTube here, but I don't want it to it's already doing that thing. So I have not yet switched on. So where do I switch it off? So Matenga, I see YouTube here, but I don't want it to. It's already doing that thing. So I have not yet switched on. So where do I switch it off? I close the browser. Okay, I have closed it now. Okay, let's see. All right. Okay. All right. Thanks. Hello. Good evening, Baba Mandaza.
Good evening to you, Baba.
Yes, this is Dr. Nyati, Fundile Nyati. Thank you for gracing us with your presence. We met last year, but you won't remember, at the mindfulness conference at the Cradle of Humankind. I was one of those people.
Yeah, I remember you.
All right. So the other people are the panelists. So there's about four, of you who will be sharing your wisdom. I'll just open the webinar, and from there we will then go through a program. Pelogazi will facilitate the program.
Yes.
Nwabisa is my support staff, so that she can help me with some of the admin. Yeah.
That's great, Papa.
All right.
Okay, 1 second, I'll be back. 1 minute.
Nwabisa?
Yes, Doc.
I've already made you a co-host, so on the chat thing, there's somebody who's greeting already. You will help me there, but let me answer for now.
Okay.
Good evening. Greeting. Thank you and welcome.
I think to do about the 4 presenters.
Okay, let me just wait for Dr. Kancho. We will be starting shortly. Hello. Right. We're gonna start any moment now.
Raise your hand and pause.
Okay. Gogo Esima is here. Good morning, Gogo Esima. Can you unmute yourself?
Greetings.
All right. Good morning. Good morning. Good morning. I think there's one person, but she will join us. Gogo Pepsile. Pelogas, do you want to say something? Unmute yourself.
Hi, Puti. Can you please send her logins via WhatsApp? Please.
No, but Pelogazi, I had sent her a link that is specific to her.
On email.
Yes, on her email. And that was like 2 hours ago. So it's going to be difficult for me to go to the other thing now. Send the poster. She uses that, and then I'll then promote her to a panelist. All right. So she must use the web ID and the passcode, and then I will, once she goes in, I'll then use that. Okay. All right. Let me write. Good evening, everybody. My name is Dr. Fundile Nyati. I am the host on this Dr. Fundi Health channel. It's my pleasure to welcome all of you as the panelists, also the people who have joined us as participants, and those who are following us via the various social media streaming platforms, via Facebook, via Twitter, via YouTube, and also via the Dr. Fundi website. It's my pleasure, like I said, to welcome you. I am going to hand over to Pelogazi, who will be driving the process for us. But before I do so, just to contextualize today's discussion. In South Africa, we are, the July month is considered a mental health awareness month. All right, it's considered a mental health awareness month as part of our health calendar. So most organizations that have got an interest in the area of mental health, they normally have some activity during this month. So in my organization as well, which is in the employee health and wellness space, we decided that we should hold a webinar to explore issues around mental health and Black people or people of color. And the reason for that is that we are in the middle of the COVID-19 pandemic. And that pandemic has actually shown that it has got a disproportionate impact when it comes to issues of health, especially mental health, to Black people, whether it is here in Africa or in the diaspora, in the US, the Caribbean, or even in the UK. Research, articles that have come through in some of the top journals have actually shown that in the US, the minorities that include Black Africans, Hispanics, and Asians, they have been disproportionately affected with issues of mental health. And part of that has to do with structural, problems, structural socio-economic problems that one can trace to the history, but also one can trace them, to some of the issues that have happened recently, including issues of spirituality in general. The same has happened in the UK. In the UK, they talk of BAME, which is blacks, blacks and Asians, minority ethnic groups. They call it BAME. Again, the same picture that one is seeing in the US, where there's a disproportionate impact of mental illnesses amongst the Black people in that part, of Europe. Again, it's almost the same as what one sees in the US. There are also other challenges that are common both in the US and in the UK amongst Black people. One is that there tends to be issues around stigma relating to mental health, something that affects, the help-seeking behavior. That is, people don't go and seek help, but sometimes it's not because they don't want to, but also the system itself has not been friendly, to them. And so going to seek help in some of these health services that are meant for them actually creates more stigmatization and discrimination. And in so doing, it creates a problem where people will sit with mental health challenges, but are not really keen to actually seek help. Now, if I bring that to South Africa, now in South Africa, we are in the majority, I'm saying the Black people. And when we talk Black people in South Africa, slightly different to how you guys see it in the US. Here, we're talking of Black Africans, that is the indigenous Africans. We talk of what we call Black coloreds or mixed race. We also talk of Black, Indians, all right? But that whole group, makes up almost 90% of people of South Africa. Now, we have come out of the history of colonialism, and just about 26 years ago, we came out of apartheid. But the structural problems in our society, as far as access to quality health services, are actually still there. There was no prioritization of mental health services generally in South Africa as opposed to physical health services. It was not done by the previous colonial governments. It was not done by the apartheid government, and even the democratic government has not done enough to change the status quo. We only spend about 5% of the annual, budget on mental health services, and the rest goes to physical health services. And as a result, majority of Black people who tend to be in the lower levels, from a socioeconomic point of view, they have got poor access when it comes to mental health services. And so with COVID-19 and all the anxiety that it has brought, with all the depression that it has brought, with all the uncertainties, and also other added issues, there are new regulations in South Africa around burials and funerals during this time of COVID. And as a result of that, if somebody has died of COVID, they must be buried within 3 days. And we are used to a situation where there's like a week, sometimes 2, before people are buried, and all the necessary rituals are actually done so that when that person is sent off, to afterlife, there's a proper burial. But because of the regulations now, if somebody has died of COVID, they are wrapped with double, wrapping. They are not supposed to be seen. There's no washing of the bodies. And generally, the rituals that are supposed to be done are not done. And we know that we always want to visit a family where somebody has died to show that we are with them in their grief. But at this time, the maximum number of people who must attend a funeral is 50. And so most family members and close people do not actually attend funerals if they do anything, they follow some of the funerals that are streamed on Facebook. And so we are looking at a situation where in the months to come, there is going to be a lot of people with complicated grief. There will be a lot of people who are presenting with trauma. And mind you, those people who have died of COVID-19, ever since they got admitted to hospital, they can't be visited by anybody. So you last see your loved one at the time that they are saying they are sick, they are going to hospital. You can't visit them. And once they are dead, you can't even see them and no rituals can be done. So I'm just painting this picture to basically say the issues of mental health, as far as Black people are concerned, there have always been vulnerabilities in that group of people. But COVID-19 has just worsened the situation. And so with those words, I want to hand over to Pelogazi, and I'll see how to assist Gogo Pepsile so that she can be able to come in. Thank you. Over to you, Pelogazi.
Good evening, Doc. Thank you so much for the introduction. And thank you so much for giving us the context of today's topic. As Doc mentioned, that we're going to be looking at the historical perspective of mental health issues in Black communities, both on the continent and in diaspora. And we'll also look at the COVID era perspective of mental health issues within the Black communities. So I will hand over first to Dr. Ganjo, who will speak about maybe from the medical social side of things, and just give us his views on this topic. Just to give you a brief introduction about Dr. Ganjo. Dr. Ganjo is a South African qualified medical doctor with over 20 years of experience in senior management in private health care and public sector, including global health economic research. Now, Dr. Ganjo has been involved in the South African Medical Association and as a registrar of medical schemes or health insurance companies in South Africa. He has extensive experience in various disciplines, having led a successful career as a medical practitioner and a regulator of healthcare industry funders. He continues to serve as a director in other not-for-profit entities, academic institutions, and corporate. He also holds an advanced postgrad qualification in applied economics, management, leadership, political economy from Nelson Mandela University, University of Cape Town, in collaboration with Duke University in the US, and also INSEAD University in France. Dr. Ganjo was a Rooney International Scholar from 2017 and served as a member of the Board of Visitors, BOV, from 2017 in the School of Nursing and Health Sciences at Robert Morris University in Pittsburgh, Pennsylvania. From 2009, he is a regular international visiting scholar, researcher, and visiting lecturer in the global health, giving numerous presentations in health economics, women's health, and HIV advocacy at various university departments in the US, that is University of Pittsburgh, Sewickley Academy in Pittsburgh, Hampton Sydney College, and Longwood University in Virginia. In 2018, he was an expert panelist in a conference summit at Magee Women's Research Institute, after which he was invited to a transatlantic roundtable race and religion biannual conference. It's also known as TRRR conference on old divisions and new social formulations, Africa and diaspora, to make a presentation on patriarchy, sexism, and the role of culture in Africa and the diaspora, women's health, and HIV/AIDS advocacy. The conference was coordinated by Dr. William Acker from Birkbeck University in London and Dr. R. Drew Smith from Pittsburgh Theological Seminary in the US. Dr. Ganjo, in the last 15 years of his career, has been doing health risk management involved in regulating the health insurance industry at executive level. He's the managing director at Africa Rising Capital and consulting for promoting access to healthcare resources and funding. In addition, he serves as a member of the board of trustees at the St. Albans College Foundation in Pretoria, and is currently a member of the advisory board on health service administration at Robert Morris University in the US. He has published numerous articles in a number of international medical journals. Having said all of that, over to you, Dr. Ganjo. I'm sure you'll make this a worthwhile presentation on your side.
Sorry, just before that, Monwe, CSP, can you just
Yes.
welcome everybody? And then, I know you're going to introduce them before they speak, but just yeah, I know I'm supposed to do that, but, just individually, just a few of us here. Just please.
Okay. All right. Thank you so much again, Doc. So in our panel today, we've got, as I've already introduced, Dr. Monwabisi Ganjo, also known as Dr. Munwe. And we've got Gogo Ekaya Esima, a friend of ours from the other side of the Atlantic, and a sister in spirit on this side. And we've got Baba Mandaza Kandemwa. Baba Mandaza Kandemwa is from Zimbabwe, and I will introduce him fully before he speaks. We've got Prof. Eric Washington. Prof. Eric Washington is also on the other side of the Atlantic. Welcome. And I don't know if Gogo Pepsile is here yet.
It's not here yet, yeah.
Okay, we've also got Gogo Pepsile Masego. Gogo Pepsile Masego of the Traditional Healers Organization, the biggest traditional healer organization in South Africa and probably on the continent. Welcome everyone, and welcome to all the viewers. Welcome to all the people that have joined us as participants, and I hope you all enjoy this. Over to you, Dr. Ganjo.
Thank you so much, fellow. Thanks, Dr. Fundi, for the opportunity, and also to focus on this important subject, which I kick off by saying it's one of those health disciplines that have been neglected, almost ignored in various institutions of higher learning, even of higher learning. And I think it is really a shame that most of our institutions of higher learning in healthcare, medical schools, nursing schools, and many such have not really put as much emphasis in as far as making sure that people who go through these institutions take mental health care seriously. Not so long ago, when one was a young medical student, psychiatry and psychological conditions is one of the areas which students themselves, and I'm sure you will agree with me, you and me having been in the same medical school at about the same time. When it came to specializing, it really received very few people showing interest in taking it further. And yet, it is one of the biggest challenges that one finds when soon as one leaves an institution of higher learning and going into practice. You have also mentioned with interest that that kind of approach has not changed much because the allocation of resources is even showing even more that, in fact, that is still the case. 5% of the GDP of the health rand, as we call it in South Africa, in US would call it the health dollar, 5% of that goes to mental health care and the rest goes to physical, what we call biological conditions, sociological and social issues. So this has been neglected and in fact ignored, and we should be looking back with shame, both as a profession and decision makers in governments and in the departments of health. That's one thing. The inequalities and inequities that we find in our society and which have been very unearthed and exposed by the pandemics like the COVID, HIV and AIDS, and many other chronic and pandemics and epidemics that we've had in the past, malaria, chronic conditions, hypertension, diabetes. These have been unearthed and have been shown now that these have to be addressed. How best to address then these? Number of ways. One is to talk about it, is to influence and make them known to the decision makers. It is also to try to address those long-standing socioeconomic defects that we find in our societies, because once you have a dysfunctional society, dysfunctional communities, dysfunctional families, and dysfunctional individuals, it has got a socioeconomic impact. I've not even gone to the political aspects of what these normally bring to our attention. So the pandemics, including the COVID-19, has shown us that inequality in our society is still a problem, and it manifests itself even in mental health care and many other conditions. What are the examples, therefore, of these many, and then they talk to the mental health care? Because during the time of COVID, when these international lockdowns, some ugly things start coming up. They start bubbling up, so to speak, from the communities, from the families. The whole question of GBV, gender-based violence, for instance, is one example that we have declared in South Africa. And in the last address that we had by the president of this country, he had mentioned that it is one of the epidemics that we have to deal with. Gender-based violence, molesting of children, assault to women and vulnerable communities. These tend to go undetected because they happen in confined spaces, in places where there's a lockdown, there's curfews around, not everybody picks up and knowing what's happening behind the high walls and in between the four walls of a household. So the GBV is really an issue which is a mental health, and again, when it comes to people of color and Black people, obviously this is of concern because there already is an area of inequality that is taking place and economic deprivation. It manifests in many ways. I mean, you mentioned depression and anxiety, both at home, as I mentioned, and in workplaces. During these areas, during these times of tough and very precarious and finding themselves hopeless, people get dependent on substances and addictions and in substances that normally they shouldn't be addicted to. All kinds and manner of addictions and dependency on drugs and some kinds of actions that under normal circumstances do not take place manifest themselves, and people get depressed and anxiety, and as I said, both at work and at home. The other area that I think it's important for us to reflect on is the health workers themselves, what we call frontline health workers in South Africa. And many around the world. We've seen it in the UK, frontline workers, nurses, and medical doctors, and a whole host of other healthcare practitioners that are in the value chain of delivery of healthcare, psychologists, social workers who must now visit these homes that are affected by this COVID, and that would have been historically disadvantaged by the nature of the social structure that we have. It's critical that these frontline health workers are supported. They are at the coalface. We call them the foot soldiers. We call them, and if you are a soldier, therefore you are in a war. And if you are in a war, you don't go to war without being given the tools and utensils and equipment to fight a war. You don't go to war without bullets or bulletproofs, otherwise you're going to be shot dead. And in the case of the frontline workers, they have to find themselves fighting this invisible enemy without PPEs, personal protection equipment, and when they come back home, it becomes a massive problem because they've been exposed to it. Now they must go back to their families. There's anxiety that's associated with that. They're helping people in the hospitals and clinics. They get home, and they meet children and women and family members, and it causes a lot of anxiety. And that's one big source where we find mental health problems. The second last thing I just want to talk about in opening this is the question of alcoholism and all the complications that come with alcohol. I do know that the liquor outlets and manufacturers of alcohol are up in arms, especially in South Africa as we speak right now, because they've been closed down. They are not allowed to sell alcohol because of these consequences that come with it, and flooding our health facilities and us not having enough space, therefore, for the COVID-19 patients. And that is one of the main areas, apart from the fact that the argument is that you can be socially acceptable by having a social drink during under these circumstances. These are extraordinary circumstances, and therefore people are sitting at home, no alcohol, and the delirium tremens, as we call it, which is a complication come from people who are having withdrawal syndromes from this. It's a psychiatric problem, and they become unsafe. Then they start having what we call illegal breweries, and then they start making some concoctions, which have got other complications as well. It becomes a cascading, vicious cycle. I think that one of the areas I'll talk about later on is what do we then do, and we'll talk about that. And I just want to close off this session by saying you must be careful on how you deal with this. And I like the analogy that says, once you hold a hammer, everything else that you see looks like nails, and therefore we should therefore be very careful on how we deal, but with expedience. Thanks, fellow girls, for that.
Thank you so much, Dr. Kanto. Maybe I'm curious to know about, there's been the lockdowns, the various levels from level 5, and now we in, I don't know, 3 plus. Oh, we in 3, but 3 something, a sophisticated 3. So in these various lockdowns and the provisions thereof, what do you see as the impact on people? Maybe from the fact that there's social distancing, number one, which is a human thing. I mean, social interaction is a human thing. Now, there's limited social interaction. There's limited visiting and interaction of people in a closer sort of distance. So what are the impacts of those? What are the impacts of those that you are finding from the medical perspective?
Oh, yes, absolutely. I mean, the whole question of social distancing, some people want to call it a little bit much more clearer by saying physical distancing. But the term social distancing has really caught up. It is an abnormal situation. Human beings are social beings. When you separate them by some form of a distance in the form of social distancing, that has got a mental, that has got an emotional disconnection. And during this pandemic, it is social distancing or physical distancing is an important aspect of stopping the spread of the virus, interpersonal spread of the cross-infection. So what happens? People are starting to become cold, so to speak. People are not hugging each other. People are not holding hands when they are greeting each other. And that is not human under normal circumstances. We might just end up with a situation where we are now in the new normal breeding a new type of behavior, a new type of people that will be so un-African in many ways. You know how Africans and people of color are when they meet, they are affectionate, they are connecting, and they get closer to each other generally. I'm not saying that doesn't happen with the other races. It's just that this emotional disconnection that we are breeding, even though it is an unintended consequence of stopping the virus, clearly is not. It doesn't augur well for emotional and psychological and cultural practices that we have. The effects of this we'll probably find in much later years to come. even generations to come. I do not know if my colleagues have known and have heard that people of Caucasian descent are not so friendly. It depends where you come from, and I don't have many of them that are very friendly people, and I connect them with very well. But for some reason, there is this stigma. It's just that people, they just think that they're cold, they're not like African. You go to Africa, you go to diaspora, you meet people, real people, and that part, we're now getting into it because we are encouraging people to be distant from each other. So below level 3, level 5 was a real shutdown of a country in this economy. Locked up at home, can't get out of your yard. Now you're getting out of your yard in level 3 in South Africa, but you are not supposed to go to a pub. You're not supposed to go to, you go to the restaurant with restrictions. You are not supposed to go to a gym and meet and other people and social. So all of those do have a mental health impact, or rather it contributes to a build-up of a psychosocial, mental, psychiatric excess, so to speak.
And again, we've been seeing every time there's numbers that are increasing, number of infections and number of deaths that are increasing. We're seeing a lot of people. We're seeing a lot of people being affected by that, and also wondering if they're the next person that's going to be sick. You know, perhaps do you have any views around that on the mental health side of things?
Well, yes. Remember also the by nature of the pathophysiological existence of this condition, it goes and it affects the respiratory tract. And I'm not talking about now the predisposing factors. If somebody has diabetes, hypertension, obesity, those are predisposing factors. But it can be a sudden killer. You talk to a person today, this morning, and you hear the person has died in the afternoon. Think of the shock that you find as an individual, and disbelief that can this really happen? Can somebody die so quickly, having us not have a chance to, when somebody has been sick for months and years, human mind takes you to expect the best and the worst that can come out of that. Now, as a medical practitioner, we're trained to be very clinical about this. We must not show emotions that will impact negatively on an individual. But as a patient, as a family member, when you get these sudden deaths, when you get these deaths in thousands of them, in millions, that's what we're going to be finding. When you find graves being dug up by the municipalities and the government in preparation for many people to die, that has got a societal, psychological impact. It makes people subdued and become helpless. And it drives them into depression. It drives society into depression because we are yet being prepared of what's going to happen, we're being told to avoid it. But look what is happening. Graves are being dug up just around in graveyards in preparation for people to die, and they die suddenly, and they die. And when they are dead, you cannot pay your respects the way that many people of color, Black Africans, normally deal with these matters. The question of cremation and funerals is now becoming not so much of a bad matter, but already new practices are coming up. Yes.
Thank you so much, Dr. Kanjo. We will have a Q&A session at the end, so if you stick around, and we'll now move to the next panelist, and that is Prof. Eric Washington. Just a little introduction about Prof. Washington. Prof. Washington was born and raised in New Orleans, Louisiana. He holds a BA Sociology, Loyola University in New Orleans, MA, Masters of Arts, History of Africa, Miami University, and a PhD, African American Church and African Missions from the Michigan State University. He is the director of African and African Diaspora Studies program. He's also a member of the board of directors of Africa Network, a non-profit consortium of liberal arts colleges committed to literacy about and concern for Africa in American higher education. In terms of his research interests, He's completing a book manuscript on African American Baptist missionaries in Africa from 1820 to 1920. In addition, he has a growing interest on the intersection of African culture and African history, and has presented papers on the works of Chinua Achebe and Chimamanda Adichie and their engagement of history. He's also been working on the life of Olaudah Equiano and his interesting narrative. Currently, he's an associate professor and director of African and African Diaspora Studies program at Calvin University in Grand Rapids, Michigan State in the US. Over to you, Prof, and welcome.
Okay, thank you. And good evening to everyone. It's a pleasure to be on this panel. I've been tasked to basically give a historical overview on really the experiences of African Americans and the implications and ramifications on mental health. So I want to start theoretically and start with the theory of social death, which was made relevant in the early 80s by the Harvard sociologist Orlando Patterson in his book, Slavery and Social Death. And what he means by social death is that if a person is enslaved, and this goes back to ancient societies, if a person is enslaved, that person can either be put to death by the master, because in ancient days, if a person was enslaved, he or she was enslaved owing to capture of war, but also could commit a crime against the society. There were no prisons, no jails in pre-modern societies, by and large, especially on the continent. There were no prisons, no penal system in that sense. So the person could be enslaved, and instead of being put to death, that person would now be enslaved to a master. And according to Patterson, the person who is enslaved is taken from his or her kin group, kin network, and you're now in another society, and you are seen as a social non-person in that society. So that's how Patterson defines social death. And obviously this particular theory definitely connects to the system of chattel slavery in the New World that was practiced in places like Brazil and the Caribbean, other places in South America and in North America, what would become the United States of America. So in chattel slavery, an enslaved person is under the arbitrary will and whim of his or her master. So the civil laws of whatever society really do not apply to the enslaved person. The master is the law. Now, this sets it up. This sets up how chattel slavery historically has affected mental health, and really those experiences still impact upon mental health. So if you look at slave narratives, and you mentioned Pelakazi, that I have an interest in Olaudah Equiano. So if you look at slave narratives like Olaudah Equiano's, Frederick Douglass, Harriet Jacobs, and others, you see very early on, say Olaudah Equiano's treatment of his experience on a slave ship. He writes that he wanted to commit suicide. He noticed others on that ship who would rather jump into the ocean than go to wherever that ship was headed. Those people had the sense that there was some doom ahead of them. And so they believed that by going to the ocean, their spirits would be carried back to their homeland in whatever part of Africa that they came from. So you see this, and even as Equiano was older, and even as he was a free person, he still dealt with bouts of depression and despondency. One other example that comes to mind is he tried to get a friend of his from being transported to the West Indies, a man by the name of John Annis, and Equiano was unsuccessful in doing that, and he learned that John Annis had died. He was beaten and tortured and died in the West Indies, and that brought Equiano real low, and he despaired of his life. So that was just two examples from Equiano. We went to Frederick Douglass. We know that Frederick Douglass, if you read Frederick Douglass's narrative, he went into a bout of despondency where he despaired, not of life itself. He wasn't, it doesn't come across that he was suicidal, but nevertheless, when he learned how to read, and he had to learn how to read through interesting schemes, and he found out that he was a slave, and a slave for life, that brought him down into a deep depression, let alone the type of treatment that he would get from one particular person, Edward Covey, who was termed as the Negro Breaker. And that man successfully at one point broke Douglass's spirit by constant abuse. Harriet Jacobs in her slave narrative, Incidents of the Life of a Slave Girl, she writes about her mental state as she constantly had to respond and react and deflect sexual advances by a slave owner who wasn't even her own slave owner. So from a woman's point of view, you have the specter of sexual abuse that women had to deal with as enslaved people. So those things lingered. So if that's just from the slave narrative point of view, but in recent years, social scientists have picked up on this, and as early as 2000, the year 2000, the psychologist Dr. Alvin Poussaint wrote a book called "Lay My Burden Down," and in that particular study, he looked at the increasing incident of young African-American men committing suicide. I remember that this started to become a focus in the middle of the 1980s. I remember Ebony Magazine doing a study on Black suicide, in particular young Black men. Well, Poussaint in that book, "Lay My Burden Down," he argued that these young men were committing suicide because they believed that the afterlife was a better place than where they were in American society. So this is research that he's doing in the 1990s, and during the 90s, and just as it is even now, and probably worse in the United States now, with the high incidence of gun violence that is particular to African-American communities, different forms of racism, such as police brutality, high incarceration rates, injustice in general. To some young men, death was better than living in that type of society. And that circles back to what we read about in slave narratives, where people did take their own lives, believing that the afterlife would be better, and that in some cases, that in some beliefs, especially among Yoruba, Igbo, other West African groups, believing that suicide would bring them back to their homeland, and there they could be at peace. And in more recent years, I believe this study came out in 2013, I believe. Psychiatrist, I'm not a psychiatrist, I think she's a psychologist, but also a social worker, Joy DeGruy. She has come up with the theory of post-traumatic slave syndrome. And she attempts here to explain modern contemporary African-American behaviors. And she argues that it's rooted in the history of slavery. So the trauma of the Middle Passage that I just mentioned with Equiano, assault of all different sorts, rape, being hunted, branded, all of those atrocities, those things are still in the collective imagination of the descendants of enslaved Africans. And again, we see this in different forms. In the early 20th century, we saw it in lynching, and people are still being lynched here in the United States. Black folk are still being lynched. Different types of assaults, verbal assaults, physical assaults, those things are still occurring. Police brutality, of course, and other things. So there's really no break, according to DeGruy, and also from my own perspective as well as studying and teaching this, that there's really a continuity from the abuse of the Black body from enslavement in the 16th century, if you look at it from the Caribbean perspective, from the 16th century to right now in 2020. And so that also leads to how African Americans view police brutality. Again, a study just a couple of years ago, 2018, was published in a British medical journal called The Lancet. And I'll read a quick quote from one of the contributors of that study. Again, the context is when African Americans view violence committed against another African American person, either on video, through social media, or even on the television. This is a quote from that report. Having seen something so horrific and traumatic that happened to someone else, I'm reminded, and again, this is the language of a person who's being investigated here, I'm reminded in a very painful and salient way that the deck might be stacked against me. And it's really hard, it's really about all kinds of insidious ways that structural racism can make people sick, because there's this connection between watching these traumatic things and thinking it can happen to me. Again, this is what these studies are saying. This is why the outcry with George Floyd was so much, because people looked at George Floyd and said, this could have been me. And so this raises the stress level. And so hypertension, diabetes, diet, people look at that and turn to different types of food to try to comfort themselves. So so all of this mental stress affects our biologies as well. So so basically, to sum this up, is that there's no disconnection between atrocities committed against Black bodies since enslavement to right now.
Wow. Thank you so much, Prof. It's just so interesting to see how this slavery has evolved from very obvious slavery as it is known to something quite sophisticated, where somebody's enslaved mentally, and the traumatic impact of that in communities and societies, and stripping them of their dignity, and how that translates to difficulties that people are experiencing emotionally and even mentally. Well, we would like to believe that you guys are better off, but actually it looks like it's the same. you know, from the colonization on this side to enslavery, I mean, to enslavement on the other side. So it's the same thing. It's like two sides of the same coin. But
Right.
thank you so much for giving us those inputs. We will engage with you later on during the Q&A, but thank you so much for those insights. Thank you,
Okay,
Prof.
you're welcome. Pleasure.
And we're gonna move to our next panelist, Gogo Ekaya Esima. Gogo, welcome, and Togoza. We would like to welcome you. Having listened to the background that Prof has given us about the impact of slavery on the mental health of the people of color on that side, it is so it's so fitting to have you as the person that's going to talk to us about the spiritual impact of that dislodgement of our people as they were carried across to the other side of the Atlantic. For those who don't know Gogo Ekaya Esima, Gogo Ekaya Esima is a traditional, or rather indigenous healer in how we call them this side. She was born and raised in the US and was initiated as a Sangoma traditional healer in the Shangaan and Zulu lineages in Southern Africa. She's a certified mental health recovery specialist, a trauma survivor, a spiritual teacher. Her own experience with mental health crisis and her at times frightening and at times profoundly beautiful journey through it eventually led her deeply into traditional African spirituality. Her ancestral calling helped her to ignite a life-saving, deep remembrance of the ancient ways within her that was forgotten but were not lost. She is a strong advocate for challenging standardized mental health concepts in America. This work has allowed her to represent the underserved in the mental health system by speaking at universities, at conferences, and summits across the country, which is how we got to know about her, though we've never really met her. It was from a conference that she was talking in that had a group of mental health specialists, psychiatrists, and psychologists. And that is how we got to know about you, Gogo. And she leads ceremonies around the world and has written for the books Shamanism for the New Millennium and Academic Writings of Women and Psychosis. She openly shares her shamanic journey of healing and recovery in the feature-length award-winning documentary Crazy Wise. Gogo Ekaya Esima's gifts include seeing and hearing voices of the ancestors, spirit mediumship, and earth-based medicinal healing. In her work, she addresses the importance of ancestral healing, a supportive community, and other integral aspects of traditional African life, and values that are specific to the healing process of our collective consciousness and liberation. Gogo Ekaya currently works in service as a full-time traditional healer in Southern California and a mental wellness public speaker. Togoza Gogo, and welcome home.
Everyone, thank you for having me here. I just want to give gratitude for the elders that have spoken before me and the elders here on the panel. I say to Kozani. Yes, you know, to follow up with on what Professor was just saying about the insidious trauma, right? And that connection ancestrally, you know, I love to share with people here on this side about ancestral healing, ancestral trauma, and remembering not only the pains and the sufferings that our ancestors went through and how that can also live within our structure, our DNA, our makeup. Those memories are still there inside of us. You know, I explained, like, as soon as you go to a doctor, the first thing that, or a medical doctor, which we have here, some doctors, you write down what happened on your mother's side of the family, what happened on your father's side of the family, who had heart disease, who had diabetes, who had mental health issues. And so as healers, what we're looking at is where we're asking what's happened ancestrally in terms of the root of the problem. What is happening on your paternal side? What is happening on your maternal side? What stories have those ancestors went through, and how is that memory being invoked or triggered within you in this moment, in terms of being in need of care. So in my journey and experience, I began not knowing anything about African spirituality being brought up in the church. My grandfather was the pastor of a church, and it was definitely, you know, I knew that as spirituality. And then as I moved on, experienced traumas in my own life, got to a place where there was this opening of seeing vision, seeing things that were not there, that other people couldn't see, I should say, or hearing things that other people couldn't hear. And in dealing with how the Western mind looks at mental illness and how the indigenous heart looks at these experiences, they flow very differently. So I was treated years ago by the Western medical model and given prescription drugs for seeing and hearing and having and needing to being told, excuse me, that I needed to stop those things, that those things needed to be dampened, that it was ruining my life, that there wasn't any stability with hearing things that were not true or not there, or seeing things that were not there. And then eventually, in the process, I was able to come to a place of seeing a traditional healer on this side who was also a Sangoma, and was told that I wasn't crazy, that I had been in and out of the hospital many times, not really understanding what the depression was about, not really understanding the root of the pain and all the emotions and the weight seemingly being carried on the shoulders. And so when I saw the traditional healer, she was like, "You're not crazy, you are gifted." And so this is what I like to bring forward is that we can, you know, this concept in Western medicine that our experience have to be suppressed, right? They have to be brushed under a rug sometimes, or through medicine, right? And not all the time, because medicine works for some of us. You know, some of us need those things, the pharmaceuticals. For me personally, it was very damaging. But when I moved into understanding that this was a spiritual issue and that the roots of my problems were began to be solved under the spiritual guidance of Isangoma. And it was a part of a calling. So in terms of the Western mind, you know, the medical model talks about auditory hallucinations. And then even, you know, I could hear even stories in my past when, you know, they would say, "Oh, you know, grandma could hear, you know, she would hear things, and she told you, you know, what you shouldn't do, what was coming up, you know, to avoid a situation." And this is something that is traditionally being passed down from generation to generation for many of us, right? And so with the Western medical model, these things are seen as definitely a sickness. And it can also be that, right? There can be these imbalances that happen within us. And so having an auditory hallucination, you know, the Black folks would say, "Oh, you could hear." You know, having a visual hallucination, they would say, "Oh, she could see." You know, having mood swings or, you know, some deep behavioral issues, you know, the question is, what is the spiritual interference? What energy is around or within or coming through? What are you being, what are your empaths? Like, what are you being vulnerable to? as well as paranoia. You know, what is the fear? What is the root and the pain underneath the depression and the anxiety? And so when I would began to have those questions asked, then I was able to kind of look and say, okay, so I am seeing and hearing things, and it's a disturbance because yes, I have to go to a work and I have to be in an office and I have to counsel people and I have to help people. And it felt like there was no room to hold these experiences in the spaces that I was in until I got to the Ndumba, until I got to where the ancestors' house, where there were specific, you know, the drums, the rituals, the songs were all medicine. Were all medicine that triggered something different within the DNA and the pain of the ancestors that was carried through my lineage, through my father's and my mother's lineage, through the transatlantic slave trade and before. And so those memories started to awaken within me by having those processes, those rituals, those drums, those songs, that medicine to go through. And as I went through it, it began to lift up my spirit. It began to shift something in me that Western medicine could not alleviate or fix. And so through that process, that's why we have to make sure that we're looking at both sides, that we're looking at, yes, what can be done in terms of a medical model, and what can psychiatrists and psychologists with their abilities be able to support somebody through. And then what can, because we're talking about whole person wellness, right? What can spirituality also support us, you know, whether it's the church, whether it's a traditional practice, you know, whether it is meditation or yoga. What are the things that are going to hold that container, which is totally different than something that Western medicine can do? There are many dimensions of wellness, right? And so we were talking about the socioeconomic aspect of wellness. Well, here, as we know, all over the world, that is a huge struggle. It has put Black folks in a place of starting the race, so to speak, at a disadvantage point, right? And so with that energy, there's this mindset and this level that impacts the mind and also the spirit, that I'm not good enough, that I'm powerless, that it's taking me longer to catch up. I don't understand why. It's because we have to begin to unpack all the ancestral traumas and rectify those. And I'm a big advocate, I don't say this enough, but I'm a big advocate of reparations, of having something here that can be a resolve for the experiences that our ancestors have went through, so that we can be on an even playing ground when it comes to social economics, when it comes to having land and property and things that were not granted to us when we were so-called freed. So there are many insidious traumas that are affecting the way that we move with our mental health, with our whole person care. And in the time of COVID, in the time of Black Lives Matters, this becomes just another trigger. You know, there's just been an increase of people having to be at home, not being out socially, because here, you know, there's a lot of going fast-paced movement, right? There's not enough time to slow down. And so now that we've had time to slow down, we've had to sit with ourselves. We've had to sit with some of the anger. We have to sit with the pain. We've had to sit with some of the trauma. The things start to come up because we now slow down, and now we can sit in the feeling. right? We don't have work to, a fast-paced job, or moving in the car all the time, or going shopping and doing all these things that we normally do to kind of, to keep us in a certain place. So being at home in COVID has particularly, I've seen lately, just have particularly brought these issues to the forefront for many of us, and even some of the triggers that where people are having more experiences around dreams and seeing visions and hearing things and feeling things that the world so easily allows us to kind of cover up at times. So, Kosa, yes, that's what
Thokoza Koko, thank you so much. Look, it is so fascinating to listen to you talking about the spiritual aspect of everything that has happened in throughout the generations and what is happening now. Maybe it makes it even more important for us to not only look at the biopsychosocial aspect of mental health, but to look at the spiritual angle as well, because I mean, clearly from what you've gone through, the spiritual aspect of the interventions that you got is what made you to recover and understand exactly why everything was happening to you, that was happening to you. And moreover, what I'm seeing as part of your journey and the things that you're doing, maybe part of your calling is about creating awareness to the Black community about the impact of what has happened throughout the generations spiritually, and the need to connect with the ancestry that is crying out, to connect with their children. And in that way, also connecting with the motherland, because by so doing, you're able, to connect those spirits that are on this side to the spirits that are crying out to connect with their children on that side. And this is something that we should actually appreciate, because it's not something that is easy. It comes with its own burden, so to speak, because it taxes you emotionally and physically. But thank you so much for giving us that perspective. And please stay with us, because we will have a Q&A, as I've said before, where people can then interact with you and ask a few questions around what you've presented to us, and maybe even more. Thank you, Gogo Thokoza. Okay, so we're going to move to our next panelist. And our next panelist, thank you so much, Baba Mandaza, for being patient and waiting with us for so long. Baba Mandaza Kandemwa is a healer that was born in Svikiro, a carrier of many earth and water spirits, and as a Mundoro, a lion spirit. I hope I'm pronouncing that well, Baba Mandaza. I'm trying. Right. Yes, he is from Zimbabwe, and he is one who is in constant prayer on behalf of others. As a vessel of the spirits, he receives visions and dreams, makes offerings, performs healing rituals, and serves as a messenger for the ancient ones, that is Abogogo Nabomkulu. Baba Mandaza teaches us to become living prayers so we can be in service of the one spirit that exists in all things. He lives in Bulawayo in Zimbabwe and travels far and wide as a peacemaker. As an emissary of Mother Nature, he guides retreats, healing ceremonies, and gatherings around the world. Baba Mandaza, in an interview that he did with the Sunday Times recently, shared his wisdom and his powerful message that expands our perspective of peacemaking and our interconnectedness to the health and well-being of Mother Earth and humanity. He says, build relationships with Mother Nature, become an offering yourself. Go sit by that mountain. She enjoys your company. Sit by the river. She is your teacher. This was a message that he communicated in that interview. And he recently led a retreat at the Damagiri. Am I correct? Damagiri,
yes.
A Buddhist retreat center on the sacred land, once inhabited by the San people in the southern Drakensberg on the border of Lesotho, where he guided a circle of meditators into a profound reclamation and remembrance of the sacredness of nature. Baba Mandaza believes displacement from the natural world is central to humankind's confusion and suffering. He says, how can a peacemaker be free when Mother Earth is being abused? How can we be free and be at peace when the waters of the world are being polluted? The movement of the earth, the movements of the clouds happen within a body of a peacemaker. He says, my body is a connector with everything. The spirits are saying there is no time for us to talk about the beauty of oneness, to write about the beauty of peace. That time is over. Become the story yourself. Miracles will happen. He says, we live in a world of mysteries. Baba Mandaza, welcome, and thank you so much for honoring us with your presence.
Thank you so much, my sister.
Yes.
And thank you, everyone who is listening to this great topic, mental health. Spiritually speaking, I went through a long and challenging spiritual journey myself. Was born and raised a Christian. In that religion or that practice, we were clearly told that the path of ancestors was a subject that was coming from the devil himself. We had to undo all that and learn a new culture that would take us to heaven. Those who did not believe in the new teachings were enemies of peace. This is exactly what we were told. Even receiving our birth names was devilish. You had to receive a new name that had nothing to do with our ancestors. In my case, the name Mandaza was changed, abandoned. I had to be called Augustine Kandemwa. That is history, which is taking place everywhere in human society, in all cultures of the world. People are being given a new path to walk that is holy and sacred, and separate that path from your own original path that gave birth to you. That information, that teaching, the new teaching, separated people from their beginning, the source of their beginning of life. This kind of separation is passed on from generation to generation. It can haunt people forever, mentally. Because people who are separated will begin to dream and receive visions about the separation and the evils of separation will begin to haunt that person, and it will affect their mental health care. This is exactly what is also happening in our world today. I resisted the call from my ancestors to be a medical healer using plant medicines that were used by my ancient ancestors. The other medicines that I was prohibited from using was visiting my relatives, whether they were poor or rich, to love them the way I should have loved them. People began to be classified. The lower class, the poor, the middle class, and the high class. That separation affects the mental health care of any human being on earth, anyone, including those who promote separation. It affects our mental health. You know, poverty is one area as a peacemaker, as a healer, traditional healer, medicine person, I've seen all that. I've handled cases of people who suffer from separation mentally. And they were taken into modern science, modern medicines, into the hospitals. And they never received healing at all from those medicines they received from the hospitals. I handled a case, for example, or some cases. Here was this young boy, a white boy, was about 10 years old. He could not speak or utter any word from the day he was born up to that age of 16. He was brought to California, where world traditional healers and scientists, doctors were brought together to share information on how to handle some of the challenges being faced by our people mentally. This boy was handed over to great healers, elders in that conference. Finally, the child was brought to me, and I did nothing at all. I was just holding the child in my hands. After an hour, this child started telling his parents that he was seeing something green from that very day. They called this boy the horse boy, the horse boy. I could feel his pain in his heart. I could feel the suffering he was going through by just holding him in my hand, because I could hear voices from my ancestors saying this child doesn't need modern medication. He's a spiritual teacher. He is a future peacemaker. Just tell this boy to go and be with the animals out in the world, the cows, the goats, the horses, and so forth. Please take him there. That was my advice. They did that. The boy was riding on a horse. He was smiling and talking to his parents for the first time. He was mentally healed. There was peacemaking in that child. Right now, he's a great ancient healer and peacemaker. There is a magazine written about that story that I'm sharing with you. You can see we have to look very carefully, like my former late speaker has just said, to listen to the wise voices that speak through you. I resisted this call, my dear, for 15 good years, and I suffered heavily. I almost committed suicide 3 times. I remember that very well. That depression, that had no solution for me. I rejected the solution, saying, I am a Christian. I would rather die a Christian. Not knowing that it is God who has given our ancestors this knowledge and wisdom of detecting the causes of many illnesses in the world. I was, separated from that world, beautiful world. Our ancestors were given this knowledge by Creator, God, Mari Musikavanu, Umkulumkulu. Our ancestors are indeed messengers of this great spirit. But again, religions and traditions and cultures do not understand that process to the depth we now understand it, that we are sharing with the world today. Yes, poverty causes mental problems, poverty. When we look at the poor people, we have two groups there. The very poor, who don't even know what is going to happen tomorrow at breakfast time. They have nothing. I've seen those. I've worked with those. There are those who don't have enough and they classify themselves as poor people. Having enough, not enough, or the little, it's medicine. We don't recognize, we don't accept, we don't go along with. It is medicine to have a little. It puts your mind at peace. Then those rich ones will have everything they want and they think they don't need even to pray for anything at all. But there is also a problem in the richest people of the world. The question is, how did they get all that wealth? How did they get it? Did they not abuse other people, particularly the poor, the unemployed, the very poor people who beg for food? You know, so that they begin to ask the question, is it a crime to be born a poor person? Is it a crime really to be captured and be a slave? I remember a story that was given to me by my ancient ancestors in a dream. They said during the partition of Africa, for example, and the slavery period, most of our people at home, where our brothers and sisters were taken from, most of those elders committed suicide. If my children are being taken like wild animals, why should I live? So they committed suicide. So it has some effects on the way human beings live on earth. It is true, yes. And one other thing is the being forced rather to belong to another culture that is not my own culture. You must be a member of our new culture. It is the best culture on earth. That I don't know much about the new culture. I know a lot about my old culture, but I'm being separated again from my ancient culture that causes suffering and pain mentally and physically as well. Such a person will have sleepless nights, forced to abandon your own way of worshiping the same God, Usiki, creator of everything. Do it our way. We cannot all be peacemakers. We cannot all be doctors and physicians. We cannot. Each person has his own path to follow, given at birth. So the separation of my gifts becomes an illness that is challenging to heal. So it is very important to find the root cause of the suffering that affects our mental health. How can a God, an ancestor, create human beings in his holy image and then gives more love to the other color? That comes to us through our sleeping dreams and waking visions. We see that kind of an illness being planted in human society. It causes suffering. Politically, again, the leadership we have in the world is abusing its own citizens in many different ways. People feel it. They dream about it because they belong to the same people who are being abused. For an example, the abuse of women in human society by our leadership in business, in politics, in religions, in traditional cultures, and all that stuff. That division causes mental health because I can feel it in my body, the separation, I can feel that. I can see it with my own eyes that are in my heart. I can see that as a spiritual person. I can see the suffering and the pain we are inflicting on the water that we drink. I feel that. So the water would become mentally ill. And the cause of the sickness and the illness could also become ill, because pointing fingers is not the way to heal the mentally ill people. It is the understanding of the root cause. Sometimes, because I'm now a Christian, I believe in Christianity, I believe in the other religions of the world, not my own religion at all. It's that kind of life, my dear friends, has taken many people to modern hospitals for healing. Therefore, we have decided to come together, scientists and people of higher learning, like you people, to come together and really go deeper into the challenges of mental health in our society. It's exactly the same thing if you go to a zoo where the wild animals are being kept, they say for safety and protection. Those animals can speak. They use their own language. They are suffering from health problems as well, because they are separated from their families out in nature there. We think we are loving them. It's not loving them. It's being cruel to them. We are inflicting mental pain to them. And how many hospitals have we built for the birds that are wounded in nature? How many? We don't care. How many hospitals have we built for our own dogs at home? We don't care. But we are building more, and more resources are being put in building modern hospitals and clinics. That comparison then, the marginalized animals, the marginalized peoples of the world will begin to say, well, is it a crime to be who I am? These people die of stress, immediate death. So these two things must never be ignored. We must come together and hold a dialogue, listen to the oppressed story, so that we reduce the number of people who suffer mentally and physically as well. Listen to their story. Go and visit the homeless person by the beach. Talk to that person. How many of us are able or are doing that, to visit and talk to a homeless person? Find out why this person has become homeless. Maybe she used to be a prosperous businesswoman and whose wealth was looted by someone, maybe of a higher class, of a better culture. You know, slavery is still with us. Oppression of men by men is still with us. That is true. How do we handle that? Is it by looking for the medicines from traditional healers or from modern doctors? It doesn't need those medicines. It requires just dialogue and peacemaking. This is what is happening in the world of mental health, spiritually and mentally. How do we go about that? My story is a long and very challenging story. Credo Mutua's story is a very long and challenging story. You know, Mahatma Gandhi's story, very challenging story. And all those people, Mother Teresa, you know, very difficult stories. They were mentally sick, those people. Even though they were given modern medicines to take once or 3 times a day, after food, after breakfast, after lunch, you take this medication from the modern hospitals. They were never healed at all. The day I accepted the call from my ancestors, I slept like never before. I was in a world of dreams and visions. That was my medicine of going back to my own roots. Going back to my own roots, classifying people like we fly on the plane, first class, special people, the ordinary people. There is no one who is ordinary. The day I was born or formed in my mother's womb, I became a VIP, very important person. So everyone is a VIP. Some people believe that they are VIPs, and I am not. I'm just an ordinary person. That creates problem, mental problem. Everyone is a VIP. We were created in the holy image of one spirit, Creator God. So this is what I can share with you, my dear friends, about this. There are many other things that we can talk about. This required for me proper workshop where we go into workshops for the whole week, my friends, on daily basis. We can understand what this subject of mental health is about. It's not an easy thing we talk about. They are also, I would appeal to our scientists to exactly find out, I still pray for that, exactly find out the causes of this coronavirus. The origin, what is the origin? Why is it targeting the Black people only? Who doesn't want to see Black people on earth? Is it God-given or is it man-made? The HIV/AIDS pandemic, was it from God or from our ancestors? I am still looking for questions, for answers to those questions. The Ebola that hit Zambia, for example, in a short period of time, people died like flies that had been sprayed on. Was that God-given illness? What had the people done wrong to anger the Creator so that he took those steps of getting rid of the people by introducing cancer, for example, or HIV/AIDS, and this virus that is killing our Black people and the poor people? Can someone please investigate thoroughly and carefully? I'm sick of knowledge. I'm a seeker of wisdom. I have to be a custodian of that wisdom. I'm appealing to my ancestors and to you, my brothers and sisters who come from high learning institutions, to investigate more on this. We don't have to believe what we are told. So this is the little I can share with you, my friends. Thank you so much for sharing this beautiful time, very important time. Let's hope the world is going to see the world the way we live in a different way. Ashe, thank you.
Siyabonga, Thokoza Baba. Thank you for sharing your wisdom with us. Just a little comment from my side. I mean, I've been listening to everyone that's been talking here, and from Dr. Nyati as he was introducing the topic, to Dr. Ganjo as he was talking as well, to Prof. Washington, Gogo Ekaya. I mean, I've listened to everyone, and there's a common thread here where the impact of the political issues and issues of oppression and slavery, the impact is so big, and it is something that we tend to sweep under the carpet. And another thing that Gogo Ekaya Isima spoke about, and Prof. Washington, the fact that when our people got dislodged, you know, as they were taken away from the mother continent, and the impact that that has currently, I mean, that happened years, hundreds of years ago, but the impact is still there even today.
Yes.
And now people are getting more and more exposed to more of the problems, from issues of poverty to continued oppression that happens in other ways. And the fact that we no longer have a relationship with nature. I mean, this is something, as you were saying, Baba, this is something that the wise ones are talking to us about, that we need to reconnect with nature. We need to reconnect with the water. I remember one of the young poets that spoke in another webinar like this, a transatlantic webinar that we had for young people, where she spoke about how the water remembers the pain. People that are not people of color, when they look at us, they say we're scared of water. Oh, white, black people cannot swim. Black people are scared of water, and how we're not so elegant when you come out of water, how we fight when we come out of water, because it looks like we're terrified of the water. What they don't understand is that our mental health has been affected by the traumas that have happened to the ancestors as they were crossing over to the other side. Those spirits are crying out, and maybe what we are experiencing when we get into water is the pain that they experienced, and that the water remembers how those people died. And that is the relationship that we now have as people of color with water. And so every time when we get into water, we think that we're scared of water. It is not just the fear, it is the memory that those spirits have entrenched on us, and saying, remember what happened to me, and we need to heal those spirits. And so what you've spoken about is something that we need to reflect on. And it is something that we need to say, how do we then create awareness about this? The fact that treating somebody with mental health issues cannot begin and end with a pill. It cannot begin and end with only talking. It also needs to connect with the spirits that we are, and it needs to connect with the spirits that are part of us every single day. When those spirits talk to us, we need to listen. When those spirits are appearing to us, we need to heed their call. And so thank you so much for sharing your wisdom, Gogo, as well. I mean, some of the parts of your journey that you've shared, and the things that you've gone through personally, and the stigmas that you've gone through, and to now understand that maybe it was for a good cause, because ultimately you're one of the people that are teaching us about how to wake up to that spiritual aspect of healing. I don't know if I could start maybe with you, Dr. Nyati. Maybe I can start with you. If you could also maybe just share a little bit about the biopsychosocial spiritual approach to healing, considering that we're talking about now, we spoke about the problems and the underlying issues. Maybe let's look at the solutions. Let's look at what are the collective things we can do from the spiritual side to the medical side to help people over these issues.
All right, before I go in, the other speaker was supposed to be in. What's happening with her?
She's struggling with connecting on her side. Apparently there's bandwidth problems. So she's still trying to connect even now. But for now, she's still struggling, a big deal there.
All right. You see, as the host, I don't like to spend too much time. You know, I come from a culture where you give to the guests, you give time, you give what you have to the guests, you know, and only when they are satisfied do you go and look what is left, you know, and then you make use of what is left. Now you want me to be the one who eats first as the host, and that's not right, you know. But anyway, look, I'm not going to be long. For me, yes, I qualified as a medical doctor 30 years ago. And I went back and I studied family medicine, which is a discipline of medicine where you basically you get more knowledge across all disciplines of medicine, focusing on what is common and leave what is uncommon or complicated for those who choose to specialize in that area. But one of the important things that I learned in that space, and this is around 1995 to about 2000, what I learned there was that when we see a patient, we need to look at the patient in totality, which is basically what Gogo Ekaya was saying. We need to look at the person in a holistic manner. Those days, holistic was biopsychosocial. That is the physical aspect of the person, what made him or her to come to see the doctor, but also recognizing for any illness, there's always a psychological reaction to that illness. And also that there is, the social aspect of health. So those days, that is what was being preached in my discipline of family medicine as holistic medicine. So, but in 2001, some gentlemen from the US came up with a new model that basically expanded on the BPS to be what is called BPSS, biopsychosocial spiritual. And he had come up with that model, after he had observed certain things and they had administered a number of interventions to people who were terminal from cancers. And so from 2001, when we talk of holistic health, we're talking of biopsychosocial spiritual. However, even today, about 19 years later, we still don't focus on the spiritual component of the whole.
Yes.
It has been very difficult for the medical profession to actually zoom into that space because it's difficult in the sense that you can't prove things in the normal scientific models, that we follow. But then who said everything needs to be proved in that model? We need to find other ways. So instead of trying to be creative to understand how we can incorporate and actually prove effectiveness of these interventions, we just let it slide. However, luckily, there is, in the whole world now, there is a group of people, scientists in India, even in the US, and even here at home, who are starting to tap into the role of spirituality in terms of, total intervention when people have got an illness. It's an area of interest for me, specifically in the area of mental health. I'm still stuck with what we call a concept note for a PhD. I should have submitted this just before the coronavirus started in South Africa. And with Corona, I have not been able to move. the point I'm trying to make, we can't just talk about this spirituality. Some of us must then go and actually research and actually bring scientific evidence, whether from a qualitative type of research or even quantitative type of research, or a mix of those two. So I'm happy to be sitting here and listening to Gogo, Stigma. When I was listening to her video earlier, in the conference that she talked about the voices, or what I would classify in the medical thing as hallucinations. She talked about a lot of things there, and I actually could relate with so many. And even Baba Mandaza has also mentioned a lot of things. And Prof. Washington, has mentioned the issues around spirituality, generational traumas and all of that. So for me, what I want going forward is that as the medical Western people, we need to stop paying lip service to holistic health. That includes spirituality. We actually need to include or mainstream issues of spirituality in a way that does not necessarily interfere with the tried and tested scientific models, however, also respects the fact that we can never be whole if we don't address the spirituality. So that really is, and for me, spirituality is broad, it's broader than religion. Religion is just one part of spirituality that has got its own doctrines and all of that, and people get to be taught around that. But spirituality is broader than religion. It also includes issues of nature. And what is interesting is that at this point, some of the aspects of Asian spirituality have now been incorporated into Western medicine and are now being accepted as part of modalities of intervention. I'm talking about mindfulness, for example. It's now integrated, as an intervention, in things like transcendental meditation. Before then, acupuncture, so we've been able to accept some aspects of other cultures or spiritualities from other parts of the world, but we have not looked at what comes from, the cradle of humankind, which is Africa, so that we can also look at what aspects of that can we introduce to make the whole. And so with those words, I think, let me hand over to other panelists.
Thank you, Dr. Nyati. I'll just go to some of the comments and questions that we've received on the chat, on the webinar chat.
Gog Pepsile is here.
Oh, Gog Pepsile. Oh, welcome, Tokoza Gogo. Welcome. We've been waiting for you, and thank you so much for coming through. But we can't see her. Doc, can you make her visible?
Okay. All right. Yeah, I can see the head and the red lipstick. Tokoza Gogo.
Oh, Tokoza Kete, welcome, Siyabonga, that you could make it. Just on time, Gogo. If you could, you missed quite a lot, but I know that a lot of these issues that we're talking about are issues that you're quite passionate about, the issues of mental health, mental health for Black communities, but in particular, the issues of spirituality and the role that it has in our mental health and in our healing. So I'll hand over to you, Gogo, but before I hand over, just so people know who Gogo is, Gogo Pepsile Maseko is the National Coordinator of the Traditional Healers Organization, which is the biggest organization of indigenous healers in South Africa. She is part of the Ministerial Advisory on Social Behavior and COVID-19 with the Minister of Health and the Minister of Social Development. She's also a pilot task team member on indigenous knowledge systems. Oh, English is not my friend today. at the Department of Science and Innovation, and she is the CEO of Pepisa Natural. Welcome, Gogo Togoza. Welcome to the platform.
Thank you very much, Gogo. Thank you very much, Pelokazi. Thank you so much to the organization for putting this together. And thank you for being patient with me. I'm really struggling this afternoon. This evening, I'm not sure what's happening. Probably it has to do with my spirituality and the computers. Bangabile. Okay, let me just, I've heard a bit from what the colleagues were talking about.
Okay, you can switch off the camera, then at least it will be better.
I think I share a lot of, yeah. Thank you. Thank you for that. Yes, I was just saying that I've heard a bit from the colleagues, and I think some of the things, let me just mention some of the things that I think are very important. It's very important that have not adequately been mentioned, which I think which have been part of my discussion this evening. One of the things is around death management.
Yes.
We cannot talk about issues of social behavior, mental health without critically looking at death management, because as African people, there is a special way on which we are able to send our people post-life. And one of the things involves burial rights, which today, or even not even today, historically, you find that during the times of wars, you find that in situations of femicides, you don't get to do a lot of those things. And those things come back to us to hit us so badly as an African house and people of African spirituality. Now we're looking at COVID-19, a very sad situation to us as African people, wherein, when you have to send your loved ones, there are so many things that we need to do as part of burial. You cannot donsa ihlahla now because they tell you this is how you need to behave if umuntu eshonile ashoniswe abulewe COVID. You don't have to be so close to the person. I've had issues of contact, of distancing and all of those things. Those things have a serious bearing on the future of an African child. The fact that today you cannot be able, to see whether or not you are burying your mother or you are burying someone else, that becomes a problem. Because in the future, we know when things are bad, you need to go back to your mother and appease. How do you appease if the person that you buried was not your real mother, just because COVID did not afford you the opportunity to see whether or not it was your mother? That is a problem during this time of COVID. The other thing that is so serious and very bad, it is the manner in which people that are responsible for carrying our corpses, the funeral undertakers, the pallors, all of that, they don't seem to understand the importance of respecting a body of a deceased. It may not necessarily be important to someone of other culture, but I want to mention this to the House today, that Those things are very important. And that is why in our culture, we normally say, "Uma ngabe, if you will be found, to be playing around a gravesite, digging people's graves, ugcine sohlanya." Because sinale nkolelo ke thina njengabantu abansundu that there are things that cannot be documented, but those things, they not need to be touched. And unfortunately, for some of these things, you do not need medicine for you to correct them. It becomes part and parcel of your way of life, and those things need to be adhered to. I've heard people were talking about the disparities between the rich and the poor. We are stuck even now. Those things are becoming serious things. The rate of the increase in corruption, that again becomes a real problem. Using Black people to front with, all of those things that are done in the name of money, of economic injection, those things have a major bearing in the mental health and behavior of someone that is poor or of less status. So some of those things. Issues of pastoral lands. We are African people. We are very close to the ecosystem. We are very close to the fauna and flora, to our animals, which we love so much. And when you tell me that I cannot be able to graze my animals anymore, and the land that is there is demarcated for a mall, I have a problem. And that affects me. When, as umakhelwane, my neighbor, you decide, because we have a misunderstanding, that it's okay, I'm gonna use poison, just spill out poison to the animals that I have, that messes my mental capacity, and that becomes a problem. Issues of jealousy and all of those things. The fact that we are no longer given bigger spaces of land, we are all squashed in this small space of land. The mother and the father do not appreciate each other anymore because children are there, and the children grows up. I do not know how many cases we have. We come to talk to at the THO, where a very old child or a person that will tell us, I used to hear my mother making some sounds, and that thing does not come out of my mind anymore, even now that I'm married. And these things are very serious. We may take them lightly, but issues of human settlement, housing, they are very big today. And I want to agree to some of the speakers that said, some of these things, they may not necessarily impact us immediately now, but they've got in the near future, they can be very deadly. And the most important thing, which I like with Dr. Fundile, is indaba yokuthi there is need for a paradigm shift. Gokuthi you that are in the Western thinking and understanding of things, there's so much that you need to learn, and there's so much that you need to to unlearn, which when you apply to the situation of Africa, they may not necessarily help you to develop your practice and also to assist in understanding the Black child. We are a special species, and we need a lot of attention than you may think. We are quite detailed individuals, and therefore we need people that are learning English, that are learning Western sciences, to understand how to look at and how to take care of the interest of a Black person with a mental illness. But also more than that, it is very, very important for academic networking. you know, for ensuring that academic spaces are shared. Because there's no way that today you can tell me that when you only learned in a certain academic institution and therefore you will not allow a gogo to come into that institution of learning and help you understand how things are better done. Situations are, the manner in which we handle situations in Africa is so very, very important, and it needs someone that is deep. You need to be deep in spirituality as well. We're not talking religion because religion is clouded by lots of politics. We are talking about spirituality because that is most central to the development of a Black child. Not only just a Black child, but any other human race. We, all of us, need to have that greater understanding. The fact that even Nati Tinabangoma today, we just inform someone in a taxi, and yet those people do not have idlos. In a long run, uthola ukuthi loyo muntu loyo ugcina asa affectekile spiritually because ngicale ukumgajeka, and later on the person realized they could not even communicate with their ancestors. There was no way that I assisted that person to communicate. There was just no network between the living and those that passed. You know, all of those things put together, it messes up a human person and a live person. So those things are very, very important that we are able to look at. The importance of ukuhlonishwa komuntu wesifazane, the respect for a female person. The fact that, you know, when your husband dies, the families, the in-laws, sekufanele mabathathe your last possession, which is that house. That affects you as a mother. It displaces you, it displaces the children. It becomes a nightmare, you know, and it creates a lot of mental disturbances to a person. And some of these things, they cannot be treated by medicine. Some of these things, they need to be treated spiritually. Some of these things need someone with the mind, with the heart, to sit down with you and communicate with you and be deep with you. And lastly, program director, there's something very interesting that we used to mention, which I'm not sure if it is still relevant today as African people. We used to say an African person, a child is, in an African sense, a child is raised in a village. It is raised by a village. I'm not sure whether today we still can continue to confidently say this, because government has removed all of the powers that made us a village. You know, government has told us that you don't have to, there's no way that I can be able to call my neighbors to talk to my child and discipline my child. If I have to do that, the children's rights organizations, government, police, and all of those people, they are going to be on me. And yet they know that this is a child that traumatizes a community, but they'll choose for some reason to just dispower me as a parent from providing parenting. And those things are very, very serious. And today we have parents that can no longer, that are handicapped, that can no longer provide parenting because government has assumed that role. It is no longer that village that raised a child. The issue of communal living, those things are very, very difficult now. We have become this nuclear family because if a person, because in the olden days, if a man that impregnated me is not able, you know, to continue the responsibilities of being a father, I would know I'll have to go to enduneni, enkosini, the family. Ngoba phela kuthiwa abazali ushayele abazali bakhe inyoni. That family would have to assume the responsibility. Today, you cannot find that anymore. And that is why we've got problems now with otatako. And those things, they have deep consequences. And I'm not sure how we are going to deal with it. I know someone is going to say to me, but these things with otatako, some of the people, you know, were far old and very old to, you know, should have corrected it within Amakosi arrangements. But we are seeing a lot of those happening now as well. And that is why there's need for us, when you are saying you are putting together a thesis, the thesis should be able to help us come out of that quagmire. How do we come up of a situation where Amakosi no longer have a role, you know, to assist in the development of a society that cannot be impacted by mental illness? Those things are becoming a serious problem to all of us. In any case, let me just, the issues of xenophobia, I'm not sure if it was mentioned. In fact, it is not even xenophobia, it is Afrophobia. Issues of Afrophobia, which are today a serious problem to all of us. How do we ensure that those people that happens to die on the soil and the lands of South Africa, their spirit is well collected to their own countries, and in a flight when you have ihlahla udonsa ihlahla, you don't get asked silly questions. Uyisaphi lento? Where are you taking this thing that you are drawing in all of these countries? What exactly is going to happen? So all of those things put together, we are born aboguti, the Black child is in a serious problem, and there is need for us to start such discourses and for us to start such communication platforms so that we can assist as well in reshaping the academic development of a scholar in mental health. Otherwise, we may get distorted. It may get distorted, and at the end of the day, we may arrive at solutions, at what we think are solutions, in a very, very not right way. So that is why it's important that we are able to assist any other person that is wanting to go into the field of mental health to understand that these things are bigger than you can think. The very same social workers and mental health nurses that we have today, they are the ones that are confusing communities even more and creating even more mental health situations to patients. What do you do? What do you do when a nurse rape a mental health patient? You know, there's quite a lot of things that we can talk about, but in any case, let me just end at this and then ask that we probably will find some other time where we'll engage further on this. I'm so sorry that I had to take so much time when actually I joined late. Thank you.
Thank you, Gogo Tokoza. We are so grateful for your inputs. That is exactly why we were nagging you to join, because we needed those inputs from you. What I like about your what you've just said to us is you're talking about the issues that from day to day we are experiencing, not just things that we read in the news. These are things that we see every day, issues of Afrophobia, as you said, issues of disparities between the rich and the poor. When you spoke about land and space, you know, where in the US, for example, there's projects and people are growing up in the projects. And here at home, we've got people that stay emikukwini or in the shacks. there's not much of a difference, and how that impacts on the mind of the Black child is something that we need to be mindful of. And the respect for females, the issues of gender-based violence, those are the things that we're currently struggling with. Death management, Dr. Nyati did talk about that, the issues of death management, but we need to go deeper in terms of understanding how the spiritual, the spiritual aspect of it is going to have repercussions in the future. And maybe we need to look at how we can then help the families to, in the future, be able to eliminate those possible potential problems. As I had said earlier, we've got comments on the chat that that we probably need to go through. Somebody, Galaxy A9 2018, I don't know who that is because they've only written the phone. Gogo Pepi brings a very important issue because as a Black people, we also practice healing of wounds of the dead. E.g., if your mother dies from shortness of breath, we need to heal the chest, the throat, so that, or the chest, the throat, so that this doesn't come back in the family. What we then refer as being genetic. Asthma running in the family and being inherited, it's a clear sign of not healing the wound of the dead. The chest being so wounded that you die. So that is a comment that is on the chat. And then from Nwabi Santlama, I concur. Sadly, these are some of the rituals that we can't do during this time of COVID-19, especially those who passed on due to COVID-19. And then here's a question from Yandisa. It is fascinating that ancestors are techies. I'm guessing are techno-savvy and globe-trotting. As someone who grew up attending Intlombe during my dad's training as a Sangoma, although he never practiced, I live with a regular thought that this could be our son's calling, and how will he or us know? So what hints did you get to choose the spiritual road that you took? And I think this came whilst Gogo Ekaya was talking. So perhaps Gogo Ekaya, if you could respond to that. So she says, so what hints did you get to choose the spiritual road that you took?
Hello, Gazi. Sorry,
Yes.
just before she answers, I've promoted the people to so that they can all appear on the, on the panel thing. So the names can actually, they can actually ask questions themselves directly.
Okay. Thank you so much for doing that. So this was a question from Yandisa. So Gogo Ekaya Isima.
So maybe Yandisa can just expand, just unmute, and then she can ask the question directly to yeah.
Thank you, Yandisa.
Hi, it's Yandisa here.
Oh, Yandisa, sorry.
From Kanduli, but based in UK.
Okay.
I grew up, especially at my young age, from around 7 to probably 15. My father was training to be Sangoma, and so I got quite accustomed to going to Intlombe and all that. Now we live far away from home in UK, and we have a young son. And I often wonder, how would I know if he is spiritually inclined, and what hints should I look out for so that he doesn't go down a road of frustration when there are better routes to get him to where he needs to be? So what hints did you get to go down this route?
So yes, the hints that I got were because I live here in America and similar to the UK, there was not an explanation for some of the experiences that I was having other than psychiatry, right? And I have to say it was divine. I was divinely led. I didn't choose it. It was like after I had been in the hospital so many times, there was a point to where I started to, there was a passion turning inside of me. So after, I think, the third time of trying to end my life, I woke up from that hospital bed and I knew that I was there for a reason. So I asked God, please show me what the reason was. And so I know that it was divine in terms of connecting to the next steps. And one thing led to another. So I started to just eventually like learn meditation. And then I wanted to read more about spirituality, which led me to find a blog, a podcast, with a person who eventually became my teacher, Baba Zanambavuza. And so the road is divinely already sought out. It's just when we choose to, either we get pushed onto the road and the destination, or we make choices and surrender to that process. And you know what I suggest, because your son is so young, is just to continue to cultivate his spirituality as well, right? We focus a lot on education, we focus a lot on the material world, but also what are your dreams in the morning? In old times, I know that we used to sit down and wake up in the morning, early in the morning, and one of the first things we do with prayer and share our dreams together. So you can implement that into the family practice of like, okay, what were your dreams this morning? Cultivating that connection with nature. These all play an essential role in stability and grounding that I think that sometimes we miss in terms of our Western society. So the more things that we can do to cultivate that connection with nature, as Baba Mandaza so eloquently spoke about, and bringing that spiritual component into the family conversation as we would with education or anything else, I think is the most important thing.
Thank you.
All right. So Pello, you can ask anybody, I mean, they are all here now. They can ask questions.
All right. But maybe we can, the person, okay, Fikile Vilakazi has raised a hand.
Yeah.
Fikile.
Thank you very much for this very, very inspiring conversation. My question is really just related to my personal story as well, around issues of mental health in my family that is also related to Ubunyanga. I'm speaking also as Ukoko Solomon in Tizwaga Kashabang. So this is the relationship between ourselves, our bodies, and the voices that we hear in our heads and in our hearts and in our soul, which emanate from the relationships that we have with the cosmic forces and the cosmic energies of the skies, the rivers, the mountains, the forests, the air that we breathe, and the people around us. So I have experienced this a lot in my family, where I think my grandmother was admitted to mental institutions because gutiwa ukulanga ngqondo, my uncle too, myself too, and my brother too, because we speak a lot in terms of people around us to ourselves. I have this tendency of just be in these deep conversations with myself and the people that I'm hearing that are living inside of me. So I always say that when I speak, there's many of us that are speaking, which is the guides and the spirits and the ancestors and the ancestresses that work with us. But I'm interested in that relationship between what that is in terms of how I feel it and explain it, because I've always said that I'm not mad, even as I was admitted into these institutions of madness as they are designed in our current moment, or at least in our physical being. And it's labeled as mental illness. And I've always contested that from the place of the spiritual realm, and understanding it not to be at least mental illness in terms of the way that Western education has taught us, you know. So my question is in relation to the relationship then between the various schools of thought that emanate from ancient times in terms of who we are, but also what we then have become to be told that we are through imposed Western schools of thought. And I'm using the word Western also selectively here because education is education and it comes in various forms, but I'm also linking it to questions of the violences of the past, right? Around things that have been stolen, knowledges that have been stolen, spiritualities that have also been stolen and renamed and relanguaged and repositioned. And some of them then have lended themselves to be labeled as mental illness. So that's my question to say, I think in terms of this conversation, how do we relate with that relationship in the current moment? During COVID-19, it's also surfacing a lot.
Thank you, Fikile. I think there's 3 people that have addressed some of these issues that you're talking about. Baba Mandaza spoke about the cosmic connection, that's one. Gogo Ekaya spoke about the mental health and the mental health issues and how the various interventions that came from what we call Western medicine and spiritual interventions and how they've assisted her. And then the other part was around issues of stolen knowledge, which I think Gogo Pepsile spoke a little bit about. So maybe if I could ask Baba Mandaza firstly to speak, you know, and respond to that.
You cannot learn about spirituality. You can only go to the elders, the wisdom keepers of that subject, who will then guide you on how to work with the voice because of the voices you hear in your heart, in your mind, and in your body, the body feelings. It is just going on your knees before a tree, just an ordinary tree of your choice. Go and kneel in front of that little rock or the mountain, that pool of water, and ask, what is this I'm hearing? Because remember, we say it is said by spirit. Spirit come to us in many different forms. They may come in the form of a beautiful mountain, like the story of this Moses, when the bush spoke to him, the burning fire, the burning bush. It is the same voice that called Baba Credo Mutwa, Nelson Mandela, to respond to, because they were having those voices on their own. Nobody heard them. So there must be a reason why you are hearing those strange voices. They are not strange at all. They are there for a beautiful reason. This is why we say there are languages we have got to learn in life. Different languages. The language of trees, the language of birds, the language of animals, the languages of land, and the language of the dead people. So those voices are a language that you should heed and heal. That's my advice. You don't need a specialist to train you how to respond to those issues that are bothering you. It's a way spirits call us for attention. That is the reason why, one of the reasons why we Black people When we face the waters, we get scared. Jumping into the water, we get scared. We have to remember that the waters, the oceans, the rivers are the burial places of our ancient ancestors who have flown from Africa to United States. Those who became sick on the ships, they were thrown into the water. It became their burial place. I was speaking to the Black Americans for years in the United States, in California, about these things during the Ma'afa thing. And we ended up going for the first time to the ocean to jump into the burial places of our ancestors. They were afraid of that. They did not know that we were going to the ocean to be able to connect and communicate with our captured ancestors of that time. That is why we are afraid of water. So my sister, I advise you to go and surrender to those calls. Let go of the fear of what will happen after you ask for guidance from Spirit. Because you did not give yourself life to live on earth. It was handed over to you by whoever handed it over to you. So respect that and be connected with the source of your voices. Thank you.
Thank you, Baba Mandaza. I think before we go to you, Gogo Ekaya, maybe if you could allow Dr. Gancho, because the question was around a collective approach. So maybe we could also just maybe from you, Dr. Gancho, and then Prof. Washington on the other side, and then we'll come to you, Gogo Ekaya Isima.
Yes, thanks, thank Palogas for that. Yes, indeed, and the collective approach, the medical science and modern scientists, if there is ever a word like modern medical practitioners, given this discussion and many more before this, the answer is guided to us by this second S in the BPS. We talked about biological, psychological, social, and spirituality. It's very important to look at things holistically. A lot of help has arisen from looking at things from the biological point of view, the advent of the penicillins and the rest of that. There's been a neglect and ignorance of the spirituality of people. And because this neglect has taken so long, problems have accumulated over a number of years, even generationally. Therefore, we now have to spend time and be patient in dealing with the neglect of what many people, particularly people, marginalized communities with regards to this. So I think in this discussion, many of my fellow panelists have really gone into detail in identifying the difficulties that come with traditional cultural practices and how to cope for those. And we up until now, we have not been having people who would have learned more and researched even how to deal from the ancient days in dealing with traditional, cultural, and spiritual matters. And in fact, we've made a mistake of equating spirituality with religion. And where the difficulty with that is if you come from the Christian background and you spend a lot of time on that and forget about the Islam, the Buddhism, and many other and African traditional ways of doing things. So I think we're on the right track, Pelogazi. I think that the more we talk about these and put them into practice, we are addressing the imbalances of the past, which brings me then to the three more other important things. And these are, you see, My background is not only in medical. That was by training. I decided to learn a little bit more about what is commonly coded as PPE. It's politics, it's the philosophy, and it's the economics. I like those subjects because they help me understand even the other aspects that we spoke about on spirituality, cultural, and racism. I think that if we think a little bit more and we talk to, and I think when we are putting it in simple terms, the wisdom that resides in many other people, the elderly, and people who hear and see things that we do not see. That's at the philosophical level in terms of my own academic background. But politics is a very important part. I know many people have been told and been warned in their homes by their parents, forget about politics, don't go into politics, that's a dangerous game. People have been told that. I think that is a dangerous advice. Politics, international political economy rules the world, it rules the finances, it rules the power balances, it deals with those. We have to deal with the politics of the imbalances of the past. And I would actually venture and say that what we need to address these challenges, or at least part of the challenges we're having to a very large extent, is actually reparation. The damage that has taken place from colonialism and slavery can really, in my opinion, be addressed by reparation. Now we have to pay back. We must find and devise innovative ways of a payback time. I'm not sure about restoration, where we cannot restore, we cannot unscramble an egg. An egg has been scrambled and you can't get it back together. So restoration to me talks about that, but reparation, it has to be done. You have to repair and make people pay, if I'm putting it in simple terms, for what wrong they've done to many of the generations. And this is where this Black Lives Matter comes in. When we say Black Lives Matter, we do not mean that other lives do not matter. We've always known that white lives matter, all other lives matter, and so on. But we're now saying that Black lives do matter. And therefore, if they do matter, certain things need to be done to make things, to correct the wrong things going forward. Maybe to talk a little bit about the solutions to dealing with this in our times and in modern times, as we deal with the broken societies, broken souls, broken health, outbreaks of the pandemics, and so on, wanting to find out their origins. And I think it's important to not to ignore the calls to find out the origins of all of these pandemics whilst we are dealing with treating them and making good. I like in US, and maybe Prof. Washington can come in here at some stage. What I now do find, and I find it very encouraging, is in all our institutions and all our organizations, we need to make sure that we bring in a new culture of embracing diversity. Any organization and institution must have a division and a department of embracing diversity, of promoting inclusion or inclusiveness. It must deal as part of its mandate the equity, in other words, balancing all this that we're talking about that have been done and people have done wrong. So the DIE, as it is called in the North Americans, in the North America, is an important one. You must have diversity, inclusion, and equity. Because if you don't do that, you are far from the starting point of dealing with the reparation and putting it back together. and bringing the marginalized communities that were marginalized deliberately. Now you have to deliberately correct these and bring people into the fold and really have many ways. In South Africa, one of the experiments that I think are on the right track is the Royal Bafokeng mining sector, for instance, where communities got in together, they were given back what belongs to them, and then the power and management of those was given back to that community to manage and distribute it to the men in the way that they wanted to. So that is only one microsome of talking towards reparation and redressing the imbalances of the past. Then that we, in as far as the economics part of it, which is not mutually exclusive from dealing with the cultural, traditional, spiritual matters, at least in as far as healthcare and the economics of our diaspora and the continent is concerned. Thanks, followers.
Thank you, Doc. Maybe let me link Prof. Washington immediately after you so that Gogo Ekaya can then come in and answer that aspect that we spoke about earlier.
Okay, thank you. Yes. Just briefly, history matters, and history links up with all of what we've been discussing this afternoon, this evening. And from the vantage point of mental health, I think practitioners, especially here in the West, by and large, who are of European descent and probably have very little knowledge of African peoples, there's going to be the cycle of mistreatment, misdiagnoses, etc., because there's a lack of understanding, and also just even how, these unconscious biases that white folk have regarding Black level of pain and tolerance of pain, where they actually believe that Black people have a higher tolerance of pain. Well, what does that come from? Well, it comes from a couple of centuries ago when Africans were enslaved on this continent, and we survived that and other atrocities committed. So there's this belief that we tolerate pain, so we're not given right treatments regarding pain. The same thing goes with mental health as well. I grew up in a neighborhood where there were a lot of people walking around who definitely had mental health problems, we would say. But they were part of the community. They weren't mistreated or anything else, and nothing like that. But definitely, in terms of looking at this from a historian's point of view, I think we have to learn, especially in the West, more about who are we as African people, and this is a debate, and this has been going on for a long time, where you hear African Americans who will say, "No, I'm Black, I'm American, I'm not African." Well, that's part of the problem, because who we are as Africans have never left. That anthropological, sociological debate was settled a long time ago. that we still possess African worldviews. We still see the world through Western and West Central African lenses. We still have high respect, and I know it may vary, but we have high respect for our elders, for our ancestors. We are the most spiritual people on this continent, especially in this country. And I think those things have to be considered. So, to treat what people would say mental illness or even mental distress, I mean, we have to approach it for African Americans. Really, we have to include spirituality. We have to include it, and to just push that aside is doing African Americans a disservice, and it's illicitly deconstructing who we are. And really that can't be done anyway. But from a clinical point of view, it's illicit. So I'll leave it there.
Thank you, Prof. Well, the last part that you spoke about, we actually have Gogo Ekaya Esima, who now has that responsibility of making sure that fellow African Americans do get to understand their history from a spiritual perspective. So Gogo, you have a big responsibility on your shoulders. So words from you?
Yes, and yeah, absolutely recognize that responsibility. And one of the things that I wanted to say in terms of the question that Gogo asked was, what came up for me is a study that was done at Stanford University some years back, where they studied people in the Americas around hearing voices, and also people in more indigenous societies in Asia and Africa and other places that heard voices. And in America, there was a high percentage of voices that were attuned to negativity, right? The voices were harmful or negative in some way and impacted their lives in a very negative way. And then in some of the other societies, there was very low percentage of that, and they talked about how the voices were happy, or they were from God, or they were cosmic, or ancestors. And I think the difference between that is, for those of us who have lost the ancient wisdom, we have to be able to reconnect to, again, nature. We have to reconnect to ancestors. So when I from my understanding on this side, when our portals can be open, the portals of the ears can be open to deep traumas, and that can go for anyone, right? And there's the voice of the creator, the divine, and there's also the voice of trauma that can be created from something that has been unhealed, unmanaged, that is out of balance and out of harmony, right? And so particularly those types of voices, a lot of what people are dealing with here that I notice, and also voices that tell them to harm themselves or harm others, there is this disconnect from that knowing of spirituality, that knowing of nature, that knowing of ancestors and creation. So what happens is the wounding of trauma becomes so infected that there's this interference that comes in, and that interference creates a larger wounding, a larger vulnerability and exploitation of the spiritual system. And so there needs to be a cleaning out, so to speak, a cleansing out, a healing. It's a call for healing. Either way, it's a call for healing. It's a call for action. In some particular cases, it's just, that healing of the ancestral trauma, healing of the wounding, healing of the pain, and then that voice will quiet, right? And then for others, there'll be that healing that happens, and then the voice, the portal that is open for that voice to come through can be aligned with a more divine connection to the ancestral guardians or to the creator. So I just wanted to mention that as well.
Thank you, Gogo. We're having a lot of comments in the background where people are acknowledging some of the things that you are saying and the things that Prof. Washington was saying, but I just want to make everyone aware that at 9 o'clock South African time, the webinar will be ending. And so, if you've got a question, if you've got a comment, please send it through, or please raise your hand, and Dr. Nyati will let you in. I just have a comment from somebody that was kicked out by Zoom, and they're watching through YouTube now. They say, I want to find out what are the ways that we as the youth can preserve our spirituality or our culture and keep it alive in this evolving world. So, and Gogo Pepsile, if she could come in after you, Gogo.
Yeah.
So there's a young person that's asking that question. How can they preserve their culture and spirituality with an African grounding and keep it alive in this evolving world?
Okay. No, thank you very much, Pelo. To respond to that, I think I'd like to draw the attention of this young person to the Indigenous Knowledge Systems Act, which is a law that was promulgated last year in August.
Yes.
The law makes it easier. I mean, it makes it clear that it is responsible for promoting, for protecting, for the development, which includes commercialization of Indigenous knowledge. So it brings out a whole lot of things. And also, and that piece of law has been neatly developed and contributed to by people that understands and respect Indigenous knowledge and what it is capable of doing and opportunities that are there, including opportunities for young people. So what I'm trying to say to this young person is, this young person has an opportunity to look into this law. All of the young people, all of the women, all of the traditional health practitioners that are here, Gogo Fikile, every other person, we have a responsibility to use this law to advance what we are about, because at least the Department of Science and Innovation has made it its responsibility to provide a safe net of opportunities for us as healers, so that instead of us going around being confused what to do with the traditional knowledge we have, how to protect it and all of that, the law tells us how best to do that. The only thing that we need to do, it is to monitor if it is done by government. It is to ensure that we push government, we enforce. Because if we do not push for these things to happen, they'll always remain on the paper. If we do not push for these things to happen, we will not be able to see corporate companies, corporates will not be able to see governments diversify, include in their development strategies knowledge holders. And yet, Professor Monwabiso says it clearly. Well, some of these things are there. The only thing that we need to do is to make sure that we push for institutions to put those things together. I mean, to ensure that those things happen. So if for those young people, I'd say at least there's a guide, at least there's a document. You just have to hold your local council accountable, ask them what they are doing about Indigenous knowledge systems. Currently, what we're trying to do as well is that we are trying to push for every department, including the Office of the Presidency, where planning happens, to push them to mainstream Indigenous knowledge. Because if we do not come with that force, Indigenous knowledge will always be something that will be treated as a peripheral thing that does not matter much. And yet we know now that politics and spirituality goes hand in hand. Maybe that's what I can do. And also the other thing that I loved with Udokotela Umonabisa Uguti, when he encouraged us to seriously look into politics and the economy, that in all of these things that we're talking about, we cannot underestimate the role that politics and the economy plays in the development of IKS. So it's very, very important that as advocates, as practitioners of indigenous knowledge systems, we're able to push. Because if we do not push for things to happen and hold people accountable and ask how much is budgeted for these things and make sure that this budget really goes into those things, we'll always be screaming and shouting at nothing. Now, let me just immediately, I hope that responds to the thing, to the question of the young person. Let me just quickly, Pelo, just go into umbuzo, the question by Ugogo Fikile. The one thing that I like with Ugogo Fikile is that she's an activist. I love her for that. And secondly is that she is so being an activist and also passionate about ubungoma bakhe. That's very, very important. What I want to say to her and also all of the other abangom abelaphi as well is ukuthi she resides in an academic institution in the UKZN. I know in UKZN there's a faculty that looks into mental health, which is led by Professor Umkize Ukabaze. I'm wondering, because there's quite a lot of programs. I know I'm part of that program as well there. I'm wondering how much active you are, Gogo Figile, in participating in all of those structures, because as knowledge holders, it is very, very important that we begin to occupy spaces, particularly spaces of education, the academia. Make sure that you do not open any hole there. Make sure that you are in all of those spaces, because if we are not there, we stand a chance of one being distinct, our knowledge being distinct. Second, diminishing, or we can be distorted. So if you are part and parcel of those programs, it is easier. We are sure, even if we cannot all be there, but at least we'll try to believe that if we're in a ukona, then it means all of us are there. But on the other aspect, which has become a generational challenge, ekayagini. You know, culturally, kunabo mama that you call emasungat. Growing up myself, I would know, in every community, there's a woman who's alive, there's a woman whose responsibility is to educate, to develop your spiritual paths. It is, her role is to make sure that she looks after the mental health of the people in that particular village. So I know, as we begin to do work, or else as we work in a lot of institutions, there are a lot of pressures and sebens. You'll find that in 1 year, you will go to a mental clinic probably 4 to 5 times a year. Not because you are mentally challenged, but because there's lots of work that you have to respond to, and the mind gets tired, you know, to respond to those things at the time and period which is expected of you to do. And that is why you need a lisungati. And also we even go further to say in Siswati, you just need your guiding angel. You know, this person that you will trust, whom you will talk to, will be a shock absorber that will help you to understand Gogbana, there is life even beyond the challenges that you face every day. You know, you just need that someone who could help you also to do that. But also you need to put a lot of pressure on employers, you know, to consider an indigenous solution, health solution to mental health. Because if we don't do that, we stand a chance kokubana all the time sinikezwe inhlobo enye, we'd be given other methods and modalities of healing that are foreign from the DNA of a Black child. So that is why you need to make sure that in EAP programs at the workplaces you are at, please make sure that you sit on those committees, you sit on those programs and try and influence so that your bodies and the DNAs are taken care of in a medicine of choice. Thank you.
Thank you, Gogo Siyabonga. We're gonna wrap up now. So firstly, just before we wrap up, Dr. Nyati, thank you so much for affording us this opportunity to gather everyone from all the parts of the continent to the transatlantic friends that have joined us here today. And I'm hoping that this discussion doesn't end here today, and that everyone that is here and participating will continue, to handle these discussions in other platforms. Thank you so much to all our participants that joined us and to the panelists that sacrificed their time and to give their energy into this discussion. Thank you so much. I know that we've started something that for generations to come, people will look at us and hold us accountable. So thank you so much. And I'll just give everyone just literally 1 minute to as a closing statement. And I will start with you, Dr. Monwai.
Yes, thank you. Thank you. This is a very enlightening discussion, ongoing. Its history goes back from the time that inequalities and oppression, colonization and slavery started. Going forward, whilst those are lingering over our heads and still drawing many people of color back, the opportunity is within our grasp. It is us, the people who are currently living now, that we have to do something about those. We can't be claiming that somebody is going to come and redeem us from this. Many people who started all of this are now dead, and many people who suffered even more than us today are also dead. It is us who are alive, and we have to do this for our future generations. So time is now. Kinako.
Thank you so much, Doc. Prof. Washington, your last few words.
Yes, thank you again. Thank you all for inviting me to this webinar. It's been a pleasure. In conclusion, I would just say that the legacies of slavery, colonialism, other sorts of anti-Black, anti-African racism is very much present in terms of the devaluing of Black bodies, and also the devaluation of the black spirit, the black soul, the Black mind. It's no coincidence that during this pandemic, that if you look case in South Africa or here in the United States, the United Kingdom, that people of African descent are suffering. We're all suffering alike. So there's that Pan-African connection that we have. It's never been severed. It's been challenged, but it's never been severed. So there's that hope. I think Pan-Africanism as a philosophy sheds hope to all of us who are the sons and daughters of Africa.
Thank you so much, Prof. Wise words. And yes, thank you so much. Baba Mandaza.
I'm so excited by what has come out of this time today. We've been given eyes by Spirit to see the kind of life we are living in this world. What a beautiful gift of being able to see what is happening among us. like my brother has spoken about, saying, we need to look at this issue holistically. I totally agree with him. For now, we are pieces of a beautiful jigsaw puzzle, just pieces. There is no jigsaw here. The way we are living in this world today, they are only pieces of a jigsaw puzzle that we can bring together and start creating a usable jigsaw puzzle. We are the pieces of that jigsaw puzzle. What are we doing about those pieces? Are we bringing them together yet? Inclusive is a beautiful idea. Include all sources of information and we'll build a usable jigsaw puzzle. Secondly, and the last thing I would like to say is that it is no longer time for one person to go and represent the whole nation to the United Nations with one issue. It is now our responsibility to come together as a people who need peace on earth to prevail, to do it together, not being represented by one person anywhere. United Nations has a document that allows us to go ahead with what we are doing on spirituality. It's a legal document, they have it. And if we also want to know about our relationship with nature, there is a book I have written that has been published now. It's in the Amazon publishing house. The world of Mother Nature. What is this world of Mother Nature? You can purchase that online, the world of Mother Nature. The world of the waters of the world of the heavens, and the world of human beings and their relationship with other worlds, to be holistically moving forward and heal this challenge we are facing, which might be faced by our young people. To that young boy who has asked that interesting question, the boys, the young girls are speaking in isolation. They are not coming together as young leaders of our future world. I spoke about this in South Africa, at that university there. To the young people, I told them never ever to work in isolation, being represented by one person or two people to such important talks like this one we are having today. This is the beginning of a long walk we are being asked to go on by Great Spirit, brothers and sisters. So let's keep on the fire burning and bring this world in order. Thank you.
Thank you, Baba Mandaza. Thank you so much. Thank you. Gogo Ekaya, last words.
Yes, I just want to say I'm really, really grateful to be amongst all of you and give gratitude again to the elders here. There's a term in Ghana, West Africa, in the Kan language, they call it say Sankofa, which means to go back and pick it up, to go back to the old ways, the ancient ways, return to the ancestors and pick up the wisdom. So I'm very happy and honored to be a part of the wisdom here today.
Thank you, Gogo Tokoza, and God bless. Gogo Pepsile, your last word.
No, thank you very much, Pelo. In fact, I also wanted to say something similar to what Gogo Kaya said, to say the most important tool that we may need to invest in is the concept of Ubuntu. I think Ubuntu will be the best method and the best tool to help us to heal the mind and eradicate mental health. Thank you very much for the opportunity presented. Thank you.
Thank you so much, everyone. Thank you so much to our panelists and to all the people that participated and the ones that are watching on all the different platforms, on Facebook, on YouTube, on Twitter, and also on Dr. Fundi channel. Thank you so, so much, Dr. Nyati. If you can just wrap up for us, and thank you to you too. It's goodbye from me.
Not so quick. All right. No, I think I can only say thank you for the 3 hours that each of the panelists, gave to this webinar to enrich it with content and enlightenment, and also for the time that the viewers on the various social media platforms, they've been glued. And I think, the main reason for this thing was to just highlight the issue of mental health as far as Black people are concerned, wherever they are in the world. And for me, whether you are in South Africa and you are a majority, or whether you are in Europe, you are a minority, or whether you are in America and you are a minority, there are certain things that even before COVID were actually negatively affecting the mental health of Black people. And when you zoom in, and in some of the literature that I went through before coming here, the issues of racism and discrimination, the issues of social and economic inequalities, the issues of mental health stigma. Generally, for some reason, Black people, they view issues of mental health from a point of stigmatization, as such that it makes people to be reluctant to seek help. And it becomes even worse when you seek help spiritually, because we've been made to think that those things are devilish. Issues of criminal justice system, So, one of the things that I picked up was the risk of psychosis amongst Black Caribbean groups, in the UK are 7 times more than whites. All right. Black men were reported to have the highest rate of drug use and drug dependency compared to the other groups in the UK. You might as well take that and bring it here at home in Africa, in South Africa, or you can take that and put it in the US. So really, if you look at the highest rates of completed suicides in the UK, Black Africans and Black Caribbeans, actually have got the highest rate of completed suicide, whilst the whites have got higher rate of suicidal thoughts, but not actually actioning them to completed suicide. So COVID-19 and this psychological impact that it brought, it comes over and above all of those issues. Some of them are actually, issues that have been there for generations. The issue of racism. Here they say there's growing body of evidence that those exposed to racism may be more likely to experience mental health problems like psychosis and depression. Now, so these are issues long before there was COVID and its impact. And so the need to provide support to people who are Black when it comes to mental health is so much more. Even better if we actually make it whole, to be able to link them, because, to matters of spirituality. And just one last thing, and then I'll be done. We need, going forward, interventions in the mental health that are race conscious and are culturally competent, focusing on dealing with issues of discrimination, the distrust of the healthcare system, and dealing with issues of historical and racial trauma, as well as those things that worked for us, which are protective factors, including social support and culturally sanctioned, coping strategies. So let's not kill the culturally sanctioned coping strategies that have helped Black people to date, which may not necessarily be formal structures. So with those words, I want to thank all of you and all the viewers to say there's still a long road ahead, but let's eat this elephant in small pieces. Thank you, Baba Mandaza, for your wisdom. Gogo Ekaya Esima, thank you very much. Prof. Washington, thank you very much. Monwei, my mentor, my first job after I qualified in medicine, I was a locum, a temporary doctor working for Dr. Gancho, and his wife, Uluki, who's also here, Muluko, Gancho. And so thank you. I'm sure we will be able to meet again. This platform is there for us to continue the conversations. Thank you.
Thank you.
How do you want me to close it? Okay, ngiyabonga, siyabonga, raleboga. Siyabonga to everyone that has joined us. And I hope, as I said, that this is not the last time we gather in this way, and maybe even in other platforms. And so, Dr. Nyati, continue doing what you're doing. I think you're doing a sterling job in bringing the various continents together, especially around the hashtag Black Lives Matter. Our minds matter, our spirituality matter, our history matters, our commonalities matter. And the fact that we are people that are not stupid. We are people that can think beyond what is seen and beyond what is visible. And we are people that can connect beyond the visible, beyond the physical. And therefore, we thank you for allowing us to have these kind of talks in a time where our history, our indigenous cultures, our spiritualities looked down upon. People like you, having studied in the Western sector of medicine, giving us these kind of platforms, raises the game, and it brings us to a point where we are all accountable for the future generations, and everything starts now. Thank you so much, and thank you, Nwabisa, for being Doc's right hand there and assisting us in managing this whole process. Thank you so much, everyone. Thank you so much to our panelists. Siyathokoza, siyabonga, ndauwe, tamaku, and God bless you.
Thank you.
Thokoza.
Thokoza.
Thokoza, namaste. Thokoza koko.
Ongashle.
Okay.
Siyabonga.
Sala kahle.
All right.
That's all the Zulu I know.
Yeah.
Uhambe kahle.
Sala kahle, Prof.
Okay. I can speak some Shishona, but not Zulu.
Yes, you can speak Shona. Baba Mandaza will understand.
Jakanaka.
All right.
Okay.
Thank you very much.
You're very welcome. My pleasure.
All right. Enkosi manawe mampele nomvuzo. Thank you very much. Thank you. I sent you a message, but yeah, thank you very much.
Thank you.
All right then.